Ezekiel Emanuel, the brother of White House Chief of Staff Rahm Emanuel, said just this year that one of the problems that we have is that doctors take the Hippocratic Oath too seriously. He quotes, as an imperative to do everything for the patient regardless of the cost or the effects to others. He went on to say that he believes that communitarianism should guide our decisions on who gets care. He says medical care should be reversed for the non-disabled, not given to those who are irreversibly prevented from being or becoming participating citizens. An obvious example is not guaranteeing health services to patients with dementia. That's from the Hastings Center report, November and December of 1996. That is Ezekiel Emanuel, who is the White House Chief of Staff, Rahm Emanuel's brother. Now, Ezekiel Emanuel currently sits as he has been appointed to two key positions: the Health Policy Advisor at the Office of Management and Budget, and also a member of the Federal Council on Comparative Effectiveness Research. It's the Comparative Effectiveness Research. He is President Obama's chief advisor on healthcare matters. That's coming straight from his mouth, that he sees that the way that we can control costs is to cut benefits to non-participating citizens of society. And that's a scary thought, folks. When you look at that, that's the road that we're heading down. Now, I will say that none of us have a clue at this point what's going to be in the legislation. We've got 3 House bills. We're going to have 2 Senate bills. They're going to beat them up. They're going to bash them around. The reality is, if we don't do our job, and our job that we need to do as citizens is stand up for our own rights, is contact our senators, contact our representatives, write them with a physical ink pen and stick a 2-cent higher stamp than it was a year ago and mail it to them instead of emails. That's going to get their attention, and we can make some headway here. It just does not make good business sense with the rising federal deficit that we've got ahead of us. We do not need to add to it. We do need to make some changes in our healthcare system. I'm not one that's going to sit back and tell you that we do not need to make reform to our healthcare situation in America, but we need to make smart reforms. We need to make long-lasting reforms. We need to look at things like tort reform. One of the biggest things that is driving up healthcare costs today is the amount of malpractice lawsuits. We need to look at some serious tort reform in this country. And there's a lot of other solutions, but let's bring our heads together. Let's come up with good, long-lasting solutions, not solutions that are going to add to our federal deficits, that are going to lead to decreased health care, that are going to lead to cut benefits.